We are very similar as sexual health service to that video. You quite often walk in, we're on the ground floor of the outpatients department. We used to be the old ED department, it's just a building. We've got a lovely door and all those sorts of things. But it's a clinic space. So in some ways it can be a little bit threatening. We don't wear uniforms, we usually wear casual clothes. You come to the window, you say, I'd like to have a sexual health checkup. Our admin staff will just offer you a form to fill out, some information. You can offer as much information as you like or as little, but we do need some important things such as a mobile number, an address, a date of birth and your name, because those sort of things go off with your pathology, and that way we know that you're you and you had a wee test and your result's yours. And then, sorry? Yes, you do, because it's all linked to pathology. And we got sick of doing Mickey Mouse 1 and Mickey Mouse 2 and Mickey Mouse 3, and they'd forget and they'd come in as Daffy Duck, and we go, we need your name, because it's to do with their safety, and that's why they wear a locked door, because it gives that level of privacy as well. And so the person comes and sees us, and we've got clinic spaces, and there's a bed and there's a table and there's bloods and all, but we're a bit of a one-stop shop, which is really nice. So we talk to the people, and I just go out, I have a conversation with the people, I say hello, and I always first name, so it's no Harry Harrison of 52 Belmore Street, Unanderra, whatever. I'll just say Harry, and yep, and come in and I do an ID check to make sure that it's the real Harry. And we sit down, and then I have that conversation about, one of the things that we talk about is, have you ever been to a sexual health clinic? If they have, great. If not, I say, look, it's a health clinic, it's just it has sexual health at the front of it, which talks about sex. I said some of the things that we'll be asking you are very personal, some of the things are not so personal. The information you give me is going to help me in relation to what we test for and what we can offer you and all of those sorts of things. And it's a conversation that just rolls off the tongue. And so I'll roll off the conversation about illnesses. Do you have any epilepsy? And that's important to know about illnesses. It's important to know if someone's a diabetic. Because if someone's an uncontrolled diabetic, they may well be having these recurrent urine infections. They think it's a sexual infection, but it's actually their diabetes. They may have this persistent vaginal rash that's actually an uncontrolled diabetes and has nothing to do with sex. So it's really important that we know all these things. It's important to know if someone's bipolar, because sometimes when persons are experiencing mania, they can go into all sorts of hyperarousal situations and they can have some very unsafe sex. So all of those sorts of things is really good to know. We ask about history of your partners. We ask about how many partners. We ask about, and you notice I use the term partner. So I don't know, when would you have sex with your boyfriend? So we talk about partners. If a person's a transgender, in other words, they may well have been born of female sex, but they've always identified as male, they've become a male. You can ask them how they like to be addressed, but usually you quite often just say Mr. or whatever. But you can ask them. If you're not sure, ask. Because part of the thing is they like to be asked, you're learning, and you start that conversation before it even happens, and they recognise that you respect who they are. And then you ask those questions about history and illnesses and all of those sorts of things. And what that does, what that information does, is that drives what we're going to be offering them for testing. And if it's a young 18-year-old female comes in and she's had unprotected sex with a boy that they met, she knew at a party, and she forgot to wear a condom, but she's not been sexually active for probably 3 months prior to that, we would probably just offer her a chlamydia and maybe a gonorrhea screen, because we're getting a bit more gonorrhea. But if she's also an 18-year-old young girl that's had unprotected sex and she was in Bali and she thought it was a really good idea to have a tattoo there because she really loved this guy and she wants to have his name on her arm forever, then we go, it's probably a good idea we do a blood test as well. Because we're worried about things like, because as I said, HIV in Australia, nicely controlled. But you go into areas such as Southeast Asia, high HIV, syphilis, hepatitis C, hepatitis B, all of those things. So that if she gives me that little bit of conversation, then I'll know, okay, we've got to do some blood testing as well. And then we might have to get her back in 3 months to make sure everything's clear. 20 minutes. That's all right, nearly finishing. So our system is a one-stop shop. We have medication, we treat people if we think somebody has a chlamydia or a gonorrhea, and you can quite often tell with gonorrhea. We will offer them treatment on the day. If they choose not to, then they must what we call abstain or not have sex. If they do come back with something like chlamydia, then we have a conversation with about, Okay, so in the last 3 months, 6 months is a bit hard for young people to remember who they've had sex with, but they may. Some of them have got them on the phone. Then we will look at contacting those people as well, because that's that health promotion thing we talk about, that prevention of, you know, someone's got measles, you've got to track who came in contact with the measles. It's the same thing with something like chlamydia. So you contact those partners, they may feel comfortable doing it, we can do it for them. And then they come in and we'll treat them, or they can go to a GP and get treated. And then those people have a conversation about who they had sex with. Did you remember ever seeing the tree with chlamydia? We had all the people in the bed, and it just gets more and more and more. And we have that conversation with them, we go, and you can see them at their head doing the math, and you go, oh, okay. So they may have only had sex with 2 or 3 people, but that 2 or 3 people may have had sex with 2 or 3 people, and then 2 or 3 people, and on it goes. And the other part of the conversation we have with people when we're talking about sexual health and their health is we will have a drug and alcohol component, because a lot of the time people make decisions under the influence that in the light of day when we shouldn't have done that. And if there is a sexual assault component, then we link in sexual assault services as well. So if we identify at-risk behaviour, we will look at at-risk in relation to a young person, then we will notify. So it depends on what the information that person's giving. So as I said, some of that information can be very, very personal and very, very difficult. You can well have a man or a woman coming in going, oh, I need a urine test, or I need a sexual health check, I need an AIDS test usually. And you find that they've had a one-night stand with a female somewhere at a conference interstate. And they're absolutely terrified, because they know the implications of what that could mean if he comes back with a chlamydia. He's going to have a conversation with his wife, because remember we had that whole conversation about we've got to talk to people who you've had, and because one of the questions that we ask is, well, when was the last time you had sex with? The big question is, okay, so when was the last time you've had a regular partner? Yes. When was the last time you were sexually active? Oh, 3 weeks ago. Okay. The next question is, other than that partner, when was the last time you had sex with somebody? And they might say, last night. And you'll go, okay. So then you have a conversation, and that can actually be a really difficult one. But we don't judge, we just negotiate to make sure that we get some sort of, and then our social worker does miraculous things. So drug and alcohol is very, very important as well, because if we see someone continuously coming back to us and they are looking at drugs as part of that mechanism, then we can talk about that as well. And if anyone is high-risk vaccination, then we also, ooh, that's pretty, then we also will vaccinate people at the same time. So a bit of a one-stop shop.